Action. Mrs. Ahagbe, we are very happy to have you in BHS Health Talk Show. Today being our first seminar on first aid. How do you feel about the program?
The program is a great program, but I think the publicity wasn't very effective. Because this kind of program is very good for the down-to-earth people, the people who really needed to hear the message and learn what didn't turn up. And that's the only thing, but it was a great program.
All right, so what have you learned today, and how would you be able to help those who are not present today to also benefit from the seminar we've had? Because we have a lot of conversation about health, about head injury, nose bleeding, heavy bleeding, choking. So how would you also help the message to the people out there who were not present here?
Like I said, yes, it was a great program. But the way I can help is to suggest to your organization that next time you are organizing a program like this, well, let's give it about a 3-month grace period and with continuous publication. And if possible, go the extra mile to make friends with a media house that can help us publicize it. And then secondly, the moderators, or how do you call it? Those of us, the panelists,
yeah.
Should be given enough time. After this morning, I was calling to find out exactly what do they want to hear from the panelists. You said health for adults and children. You might have an objective for what kind of health are we talking about? First aid, something. What kind of first aid? Like we hear Sister Sabina says. It's a broad topic. First aid is a very broad topic that cannot be exhausted even in 24 hours. So I would suggest that next time we narrow it and give sufficient time for the facilitator, for the panelists to do research. For instance, if we were going to talk about head injury is a very common thing that we see on the roads, in our homes, in our workplaces. We could have been able to delve deep into it for people to understand it. Okay? If we were talking about head injury in children, it should be health injury in children, so that we delve deep into it. You see that the last 3 or 4 most important ones, they have to cut it short because of time. But they were the most important things, heavy bleeding, how to control it and all that. So it was too broad for the time frame.
Thank you very much. We're so glad to have you in our first Health Talk seminar, and we know that the panelists and the audience have learned great things from you, being a retired nurse and having full experience on health issues and how to handle most of the casualties. And then we are so grateful that you were here, and then we hope to have you in our second Health Talk. Probably will be in the media house so that the people out there can be able to educate the people on how to handle critical health issues when it comes to domestic incidents, accidents, and before we can be able to call for professional advice. Thank you so much for having. We are so happy. We are most grateful, and then we hope to see you next time.
Thank you. You are welcome. It's my pleasure, and I also thank you for the privilege given me to recollect what I stopped practicing for a while. Now I'm on the alert, and I'll go back to my drawing board and start doing more research for subsequent opportunities. Thank you so much. Thank you.